With each heartbeat, around 5 liters of blood are pumped through your body. Blood flows through a huge number of kilometers of blood vessels, delivering oxygen and nutrients to the organs and carrying waste products away. Blood likewise transports cells, hormones and proteins that regulate many body functions, such as fighting infection and controlling blood loss. What are the components of blood? Red blood cells Red blood cells look like tiny donuts without holes. Their red color comes from hemoglobin, which is an iron-containing protein that ties to oxygen and carbon dioxide. Red blood cells utilize their hemoglobin to carry oxygen from the lungs to the tissues and organs. Red blood cells at that point get the carbon dioxide from the tissues and organs and convey it back to the lungs for expulsion. In a healthy person, a red blood cell stays alive for around 120 days. The average adult has about 25 trillion red blood cells. To maintain this level, the bone marrow in an individual's body produces 7.5 billion red blood cells consistently, or about 2 million a second. Red blood cells are segregated from donated whole blood and reconstituted in an additive solution that permits their storage at 4 degrees Celsius for several weeks until a patient requires a transfusion. At the point when red blood cells are damaged, lysed, and their content is released into the blood, we say the blood is hemolyzed. Red blood cells that are damaged can no longer carry oxygen and the released cellular content is poisonous to the body. High levels of hemoglobin and other cellular debris can damage the kidneys. White blood cells. White blood cells help battle infections. When viruses or bacteria enter the blood, for instance through a cut, a scratched knee or an infected ear, white blood cells encompass and destroy the attacking microorganisms, bacteria and viruses. The 3 primary types of white blood cells are granulocytes, lymphocytes and monocytes. Granulocytes are the most abundant white blood cell and act as the first line of defense by swallowing microorganisms, phagocytosis, and executing them with enzymes stored in granules inside the cells. Lymphocytes recognize antigens on the outside of invading bacteria or viruses as non-self. At that point produce antibodies that disable the invading germs and target them for destruction. Monocytes support the action of other white blood cells through phagocytosis and identifying targets to be destroyed by antibodies. Most white blood cells live for a couple of hours or days in the blood, so the bone marrow is continually delivering more. In any case, a small number of lymphocytes, sometimes called memory cells, live for a long time to remember certain infection and help the body oppose being infected again. Vaccines work by setting the body to create these memory cells without really making us sick. In transfusion, white blood cells are removed from the last blood products. This procedure provides several benefits to patients receiving transfusions. Firstly, they are less likely to have a fever after their transfusion. They are also less likely to make antibodies against transfused donor cells, and so future platelet transfusion will remain effective. White blood cells may also harbor infectious disease agents such as cytomegalovirus (CMV). By removing them, we reduce the risk of infection. Platelets. Platelets are small, fragile, plate-shaped cell fragments that help stop bleeding by sticking together and forming a clot that seals a gap in the blood vessel. Clot formation is triggered by the platelets coming into contact with torn blood vessels. This initiates the platelets. Activated platelets become sticky and change shape, extending long, thread-shaped structures that help them clump together. The activated platelets interact with clotting factors in the blood to form a stable clot made of platelets held together by a mesh of protein fibrin. At the surface of a cut or scrape, this plug becomes a scab to keep germs out of the body. Platelets remains functional for about 10 days in a healthy adult. New platelets are framed by cells called megakaryocytes in the bone marrow. Each megakaryocyte releases thousands of platelets into the blood. In transfusion medicine, platelets are secluded from donated whole blood and reconstituted in plasma for storage prior to transfusion. Platelets can likewise be gathered from a donor by an apheresis machine that permits the particular collection of platelets and some plasma. Platelet products must be kept at room temperature and can only be saved for a few days before transfusion. Plasma is the straw-colored fluid that makes up the greater part of the blood's volume. Plasma acts as a transportation system for everything in the blood. Around 90% of plasma is water and the other 10% is comprised of the different materials being transported by the plasma. Plasma brings nutrients like proteins, minerals, vitamins, sugars, and fats to all parts of the body and carries away waste products. Plasma also carries the red blood cells, which transport oxygen and carbon dioxide to and from our organs and tissues. The persistent circulation of white blood cells and antibodies in the plasma permits them to go wherever they are needed to fight invading germs. Correspondingly, flowing platelets and clotting proteins will be triggered anywhere blood clots are needed. Proteins that flow in the plasma include albumin, antibodies and clotting proteins. Albumin is the most abundant protein in the plasma, and aids to sustain fluid balance in our body by keeping water inside the blood vessels. Antibodies make up more than 1/3 of the protein in the plasma. Clotting proteins in the plasma are required for platelets to form blood clots. In transfusion medicine, plasma is segregated from donated whole blood. Plasma can likewise be specifically gathered from donors by an apheresis machine. Plasma products can be kept frozen for long periods of time, up to 1 year, until transfusion is required. In transfusion medicine, proteins such as albumin, immunoglobulins and clotting factors are secluded from plasma using a fractionation process. Once fractionated, those proteins can be stored freeze-dried, lyophilized, for extensive stretches of time and be utilized to treat explicit ailments. How is my blood type determined and why you need to know? Blood groups are genetic, similar to the color of an individual's eyes. There are 4 significant blood groups: A, B, AB and O. Blood groups depends on red blood cell antigens, which are proteins on the cell surface that are perceived by a person's immune system. In the event that an antigen is recognized as non-self by the immune system, the cell is targeted for destruction by antibodies. Group A has one type of antigen A, Group B has a different type B, Group AB has both A and B antigens, and Group O does not have either antigen. These blood groups are further divided by whether or not an antigen called the Rh factor is present on the individual's blood cells. In the event that it is available, that individual's blood is Rh positive, plus, if not, the blood is Rh negative. Combining Rh factor with the 4 significant blood types brings about 8 distinctive main blood types, for example, AB. In addition, there are minor blood groups. A person of a specific blood type will create antibodies against the antigens that they don't have. For example, a blood group A individual has no B antigens on their red blood cells. Subsequently, this present individual's white blood cells will make antibodies against the B antigen, anti-B, that will be available in their plasma. In transfusion medicine, it is significant that patients accept red blood cells that are compatible with their blood type. It is also important that plasma recipients are not transfused with plasma that contains antibodies that will destroy their red blood cells. Blood types can be determined swiftly by mixing a couple of drops of someone's blood with anti-A, anti-B or anti-Rh antibodies and seeing which antibodies make the red blood cells clump together. This clumping happens when the antibodies match the antigens present on the red blood cells. For instance, if someone's blood clumps with anti-A but not with anti-B antibodies, this shows that the blood has A but not B antigens, making that person type A. In transfusion medicine, refined assays are utilized to properly type the blood of the donor and of the patient. What is meant by a blood match? With regards to blood transfusions, a blood match is a compatibility between the donor's blood and the recipient's blood. This does not generally mean a matching blood match. Red blood cells from a donor that is type O+ can be transfused into patients of 4 different blood types: A+, B+, AB+, and of course O+. Individuals with type O blood are called universal donors because their donated red blood cells have no A, B or Rh antigens and can consequently be safely given to individuals of any blood group. People with type AB+ blood are universal recipients because they have no antibodies to A, B or Rh in their blood and can receive red blood cells from a donor of any blood type. Plasma transfusions are matched to avoid A and B antibodies in the transfused plasma that will attack the recipient's red blood cells. Individuals with type AB blood are universal plasma donors. Their plasma does not contain A or B antibodies and can be transfused carefully to all blood types. Blood types are determined by the presence or absence of certain antigens, substances that can trigger an immune response if they are foreign to the body. Since some antigens can trigger a patient's immune system to attack the transfused blood, safe blood transfusions depend on careful blood typing and cross-matching. Do you know what blood type is safe for you if you need a transfusion? Here are specific ways in which blood types must be matched for a safe transfusion. The right blood transfusion can mean the difference between life and death. You will be told which ABO blood type you have. It will be one of these: type A blood, type B blood, type AB blood, type O blood. You will also be told whether you have Rh positive blood or Rh negative blood. Also, they will determine which type of blood you can safely receive. If you have type A blood, you can only receive types A and O blood. If you have type B blood, you can only receive types B and O blood. If you have type AB blood, you can receive types A, B, AB, and O blood. If you have type O blood, you can only receive type O blood. If you are Rh+, you can receive Rh+ or Rh blood. If you are Rh, you can only receive Rh blood. What is a universal blood donor? Universal donors are those with an O-negative blood type. Why? O-negative blood can be used in transfusions for any blood type. O-negative is the most widely recognized blood type used for transfusions when the blood type is unknown. This is the reason it is utilized regularly in instances of trauma, emergency, surgery, and any situation where blood type is unknown. O-negative is the universal blood type. Types O-negative and O-positive are in high demand. Only 7% of the population are O-negative. However, the need for O-negative blood is the highest because it is utilized frequently during emergencies. The need for O+ is high because it is the most frequently occurring blood type, 37% of the population. O-negative blood type can only receive O-negative blood. Type O-positive blood is given to patients more than any other blood type, which is why it's considered the most needed blood type. 38% of the population has O-positive blood, making it the most common blood type. O-positive red blood cells are not universally compatible to all types, but they are compatible to any red blood cells that are positive A+, B+, O+, AB+. In major traumas with massive blood loss, many hospitals transfuse O-positive blood, even when the patient's blood type is unknown. The risk of reaction is much lower in ongoing blood loss situations, and O-positive is more available than O-negative. Type O-positive blood is critical in trauma care. Those with O-positive blood can only receive transfusions from O-positive or O-negative blood types. Type O-positive blood is one of the first to run out during a shortage due to its high demand. What is the universal recipient blood type? You are probably aware that giving a person a blood transfusion with an inappropriate kind of blood can be deadly, leading to rejection and often death. However, you may not know that individuals with type AB blood can safely receive blood from a donor with any blood type, O, A, B, or AB. This person who can accept a blood transfusion from any blood type is called a universal recipient. What is a rare blood type? There are more than 600 other known antigens, the presence or absence of which creates rare blood types. Your blood type is considered rare if you lack antigens that 99% of the people are positive for. If you somehow lack an antigen that 99.99% are positive for, your blood type is extremely rare. Types of blood transfusions. There are several common kinds of blood cell transfusions. A red blood cell transfusion may be used if you have anemia or an iron deficiency. Platelets are tiny cells in the blood that help you stop bleeding. A platelet transfusion is used if your body doesn't have enough of them, possibly because of cancer or cancer treatments. A plasma transfusion helps replace the proteins in your blood that help it clot. It may be needed after severe bleeding or if you have liver disease. During the transfusion, you'll likely go to your doctor's office or a hospital to receive your blood transfusion. The new blood will be given to you through a needle and an IV line. You'll be monitored in case there are any problems. Risks and complications. In general, blood transfusions are considered safe, but there are risks. Sometimes complications show up immediately, others take some time. Fever. It's usually not considered serious if you get a fever 1 to 6 hours after your transfusion. But if you also feel nauseated or have chest pain, it could be something more serious. See your doctor right away. Allergic reactions. It's possible to experience an allergic reaction to the blood you receive, even if it's the correct blood type. If this happens, you'll likely feel itchy and develop hives. If you have an allergic reaction, it's likely to happen during the transfusion or very shortly after. Acute immune hemolytic reaction. This complication is rare, but is a medical emergency. It happens if your body attacks the red blood cells in the blood you've received. This normally takes place during or right after your transfusion, and you'll experience symptoms like fever, chills, nausea, or pain in your chest or lower back. Your urine might also come out dark. Delayed hemolytic reaction. This is similar to an acute immune hemolytic reaction, but it happens more gradually. Anaphylactic reaction. This happens within minutes of starting a transfusion and may be life-threatening. You may experience swelling of the face and throat, shortness of breath, and low blood pressure. Who can donate blood? Age. If you are aged between 18 and 65. In some countries national legislation permits 16 to 17-year-olds to donate provided that they fulfill the physical and hematological criteria required and that appropriate consent is obtained. In some countries, regular donors over the age of 65 may be accepted at the discretion of the responsible physician. The upper age limit in some countries are 60. Weight. You weigh at least 50 kg. In some countries, donors of whole blood donations should weigh at least 45 kg to donate 350 ml plus or minus 10%. Health. You must be in good health at the time you donate. You cannot donate if you have a cold, flu, sore throat, cold sore, stomach bug or any other infection. If you have recently had a tattoo or body piercing, you cannot donate for 6 months from the date of the procedure. If the body piercing was performed by a registered health professional and any inflammation has settled completely, you can donate blood after 12 hours. If you have visited the dentist for a minor procedure, you must wait 24 hours before donating. For major work, wait a month. You must not donate blood if you do not meet the minimum hemoglobin level for blood donation. A test will be administered at the donation site. In many countries, a hemoglobin level of not less than 12.0 grams per deciliter for females and not less than 13.0 grams per deciliter for males is the threshold. Travel. Travel to areas where mosquito-borne infections are endemic, e.g. malaria, dengue and Zika virus infections, may result in a temporary deferral. Many countries also implemented the policy to defer blood donors with a history of travel or residence for defined cumulative exposure periods in specified countries or areas, as a measure to reduce the risk of transmitting variant Creutzfeldt-Jakob disease (VCJD) by blood transfusion. Behaviors. You must not give blood. If you engaged in, at-risk, sexual activity in the past 12 months. Individuals with behaviors below will be deferred permanently. Have ever had a positive test for HIV/AIDS virus? Have ever injected recreational drugs? In the National Blood Donor Selection Guidelines, there are more behavior eligibility criteria. Criteria could be different in different countries. Pregnancy and breastfeeding. Following pregnancy, the deferral period should last as many months as the duration of the pregnancy. It is not advisable to donate blood while breastfeeding. Following childbirth, the deferral period is at least 9 months as for pregnancy, and until 3 months after your baby is significantly weaned, i.e. getting most of his/her nutrition from solids or bottle feeding. Take care of your blood.